Good morning, ma'am, sir. Uh, Ma'am, I'm sorry we are watching the presentation. Today I will be presenting about the brain disorders, basically two brain disorders. First is epilepsy, second one is Alzheimer's. So, yeah. Yeah. So first of all, in the presentation, it is we will see yes. So brain diseases, and we will know more about brain and what are the brain disorders sort of thing. Now, in the index, I would present what is brain basically, what are some brain diseases, and then epilepsy and seizure disorders and Alzheimer's disease. Now, there's this quote by George Bernard Shaw. It says that the sound body is the product of sound mind. So basically, mind and body are connected. So in the past few years, we have researched enough about our body, like on organs, and we know how to transplant organs now. But in the research in brain, we are not quite able to solve the problems that are related to brain, and especially the brain disorders and all. So therefore, I guess I think that we should do more research in the brain areas because there are lots of things that we don't know yet. First of all, what is brain? So brain is a complex organ that controls thought, memory, emotions, touch, motor skills, vision, breathing, almost everything in our body is controlled by brain. We also say that brain is the CPU of our body. So yeah, together the brain and spinal cord that extends from it makes the central nervous system or CNS, and that take care of our whole body. Now, it is just an intro that brain has four temporal lobes, like four lobes, basically frontal lobe, parietal, temporal, occipital. They have different work. Like frontal lobe is for personality characteristics, decision making, movement, and kind of things like that. And parietal is for help a person to identify objects and understand things, spatial relationships, and etc. Temporal lobe, however, is used for it. These are the sides of the brain. Basically, temporal is the side, frontal is frontal, and parietal being this side, and temporal this. Occipital is back. So occipital is for basically vision purpose, and temporal is for speech, music, rhythms, recognizing them, basically short-term memory kind of thing. Yeah. Now, there are neurological disorders. They are of different types. We can see tumors. We have seizure disorder, which I will be talking about. One of them is epilepsy, seizure disorder. Then we have cerebrovascular accidents. Then we have disorder of development, then neurological infections, then degenerative disorder, which one of them I will be talking about is Alzheimer's. And then we have headache and facial pain, which usually most of us, have seen headache kind of thing. But these diseases like seizures and Alzheimer's, Parkinson, these are, I would not say very rare, but these are not a common disease that we all see in daily life, but they are very much affecting the human life now. So after studying about what are the different brain disorders, now I will be talking about epilepsy or seizure disorder. So epilepsy is a brain disorder that causes reoccurring and unprovoked seizures. So basically, we don't know when it will happen, but it will happen. Seizures will come, but we don't know when. Your doctors may diagnose you with epilepsy if you have two unprovoked seizures or one unprovoked seizures with a high risk or more. Not all seizures are results of epilepsy. So basically what happens is that not all seizures are result of epilepsy, but still epilepsy comes under the category of seizure disorders. Seizures may relate to a brain injury or a family trait, but often the cause is completely unknown. We, as I told earlier, that brain research is very far behind the body research scientists have done so far. So we basically have not the complete knowledge that why seizures occur, but we do know that some part of it that it occurs because of the high electrical signals, and when much neurons pass the signals together, and I mean the unexpected ones, that create seizure. The word epilepsy simply means that the same thing as seizures disorder. It does not state anything about the cause of person's seizure and their severity. We know a person has epilepsy when they have unprovoked seizures. That is it. In the diagram, in the figure, we can say, so what is epilepsy? Signal travels to axons to synaptic nerves, neurotransmitter across, these all processes happen. But why does seizure happen? So let's go to the next slide. We have this visual representation when we can see that what happens is that our brain continuously sends signals to the different parts of brain so that we can communicate, we can do daily activities that we do. So what happens in seizures, you can see in the diagram that normal we have brain signals. Normal we have simply this in same you can say phase, amplitude. They have same phase, same amplitude, and they are just going. But in epileptic seizures, you can see that they are like increasing. It's like it's not normal. It's not in a continuous phase, and they are. And now this is push-pull control, synchronized push, movement behavior, and then we have desynchronized push to stop the movement behavior. Basically, what happens is when we have seizures, we have uncontrollable movement in the body. You can see in the figure that it is moving, but the person cannot control their seizures. And they are like not a rhythm. They don't follow any rhythm. They just increase, decrease, kind of like that. And that happens because of the electrical activity that over occur due to, we don't know that. The reason is still unknown, that why does that happen. But we do know some fact that it happens because of the over, we can say electric signals that fire in the brain. And now I will be showing a video which is showing what it actually looks like when we have seizures. So you can see. So the patient is continuously moving, doesn't have any control over their body, and the doctor is like not even touching the patient. They're like, let it be. And then do their procedure, turn it and all. So as you can see, we didn't get to know why does it happen, how come all of a sudden we don't predict the time interval that, oh, in this time interval it will happen. So therefore the treatment of epilepsy and seizures basically is kind of difficult because we don't know when it will occur. So this is just a video which it shows. Also now, before coming to Alzheimer's disease, I wanted to show that we have two types of seizures basically. The first type is focal seizure. What happened in this focal seizure is that we know a particular area, that's in this area specifically the seizure will come. But in the other type of seizure it is called generalized seizure, that we don't know where is the clear focus. We don't know from which part of brain the electric signal will get high, and they basically occur the seizures. We don't know in the generalized seizure, but in focus we do know that, okay, this part of the brain is causing seizures. But in generalized seizures we don't know. So the treatment is not very simple on this. Now, after talking about seizures and epilepsy disorder, we will talk about Alzheimer's disease. So it is basically a neurologic disorder, and it is a degenerative neurological disorder in which what happens is that it degenerates the cells. Basically what happens is that it degenerates the cell, it decreases the amount of cells. So Alzheimer's disease that causes brain to shrink and brain cells to die. Alzheimer's disease is the most common cause of dementia, a continuous decline in thinking, behavior, and social skills that affect a person's ability to function independently. So what happens that basically but now the thing is that Alzheimer's disease is very kind of now becoming common, because not in my household I have seen this, but I have known people that are related to me and they have Alzheimer's disease. So it is like, now it is not a rare disease, we can say. We have people around us who suffer from Alzheimer's disease, and it usually occurs to older people as compared to the younger generation. The early signs of disease includes forgetting recent events and conversations, and a person with Alzheimer's disease will develop severe memory impairment and loss of ability to carry out everyday tasks. So one of my friend's grandmother has this Alzheimer's disease, and she told me that what happens is that her grandmother go out from the home, and then she just walk like a little distance, and then she forgets everything. Then why is she there? Where she lives, and who is she? So she forgets everything, and then she is in the midst of from outside her home, and she don't know where she is, who she is, and this definitely caused a lot of trouble to the family members, to her herself. And then what my friend told me, that what they do is that lock the home so that her grandmother don't go out from the home, so because it is dangerous for her to go out, because she doesn't know where. She forgets things very easily. Sometimes she forget who is her own daughter or son, whatever. So it is very we can say very dangerous kind of disease, because a person forgets everything, so they don't know who they are, where are they from, and things like that, which are very essential for someone to live in the world. Now, here in the diagram, you can see the normal brain has like full sulci, cortex, white matter, but in Alzheimer's brain, we can clearly see that the part is shrinked. Now, in the other, what actually happened in brain when the Alzheimer's occur? Like what we know till now. What we know till now is that neurons die basically in Alzheimer's, and most of the part from the hippocampus. And as we know, hippocampus is very important for memory portion, and that occurs, and because the neurons die, most of the neurons die from the hippocampus part, therefore the memory plays an important role, and the person forget things easily. And we can say that Alzheimer's disease usually begins in the hippocampus structure source, which is a part of the brain that plays a role in memory and thinking, as we know. Typical brain metabolism, a process, basically a chemical called amyloid, APP. So basically we will read about this later on soon. So what happened basically is that this protein is very important for the degeneration of okay, so this protein is important for the neuron and other stuff, but when this protein reacts with the beta amyloid, which is a bad thing. When this happens, Alzheimer's do happen. I mean, the degeneration of neuron cells occurs. So now the second, here we can clearly see that what happens in normal brain, what happens in Alzheimer's brain. We can see that there's enlarged ventricles, there's whole, very huge holes, entropy, several, you can see that here the area is shrinking. Here we have the whole matter, here's this hippocampus, we have cerebral cortex, and you can see that the basically white matter is also decreasing at very high rate. It is decreasing so much. Yes, and now we have is, okay, so before that, we have this video to watch. Yes, so what we have here is yeah, so this is the APP, which is very important for, to generate neurons again. Yeah, so it has two ends, outside the cell and inside the cell. And yes, it helps neurons to grow and repair. And it gets, yeah. So what happens, it is a protein that get used, it get broken and then recycled again. So what happens is when there is alpha secretes that chop it off and then it regenerates. Then there is gamma secretes that chop it off in this wall, this from this, and it chop it off, and then again it regenerates. That's a good thing to do. That's a very good thing, and it is soluble. When they chop it off, it's soluble with the blood or whatever, and things are better. But the problem occurs when beta secretase come. When it came and it chop it off this portion, and then the problem. And now what we have is this portion, which is chopped off by beta secretase. So that this portion is not soluble, and here the problem occurs. What happened next, you can see in the video. Yeah, so the portion that we see, which was not soluble, it come out from the neuron, and it kind of form a group, and then it increases and increases and increases. Yeah, and then it creates a beta amyloid, and that causes trouble to the neurons while passing the signals, and signal doesn't get transferred to one neuron to another neuron because of this beta amyloid plaque. That is basically amyloid beta, which was created by we see the chopper of beta by the beta secrets. So now this creates the problem here. Yeah, and this also causes the blood have a hemorrhage in the blood vessels in brain, which is basically by the amyloid angiopathy. Yeah, these are basically, yeah, these are the ones you can say, yeah, these ones, these here, these here, this here. These are the amyloid plaque that come. And now that was happening outside the neuron. We mostly know what happened outside the neuron. We basically see what happened there. It forms a cluster, and it it occurs problem between the two neurons to make transfer signal, because make a cluster here, and we are not able to basically send these two neurons. We want to send signals, and it is a cluster, so we cannot send signals now, and that is outside the neuron. Now we have inside the neuron. Inside the neurons, we know there are microtubules. The tau is a protein that basically binds the microtubules in their tubular form. Yeah. Yes. So what happened is that we know what happens outside. Now inside, what happens? The phosphor group came, and they take away the tau. And then tau make a whole cluster. And then this happens. So microtubule is now break apart. They are not anymore together. They because of tau protein, because of the removing of tau, which happened because of the sulfate we see. And here we can see this cannot pass one into another because it is broken now. So therefore the signals are not able, transferring. Yes. So what happened because of the microtubule, having the microtubule, this causes apoptosis, programmed cell death. So here we can see outside they're not able to transfer the message, and inside the programmed cells are dying. And now here we can see the neurotubule tangle, basically this one here. Now, because of the entropy, now the gyres are shrinking, and the gyri are becoming, this is a gyri of normal, and this is the gyri of Alzheimer's brain. So yeah, it shrinks. And this is, and here the cell guy, which has very less gap in between them. But now in Alzheimer's, what happens is that it gets wider, and that makes a ventricle larger. Yeah, now this is just that how and why it happens. And now basically these are the symptoms which we should not ignore. Sometimes what happens is Alzheimer's is a very spreading disease nowadays. It is increasing at very fast pace. And firstly, we might not be able to detect it, but it's fine. But then short-term memory loss, loss of motor skills, language, then we forget long-term memory loss. And then what happens is disorientation, this getting lost, which I told you in that story. One of my friend's grandmother usually forget everything and she get lost in the way. So disorientation. So this is like, and then bedridden and death infection. So this is all the way. And now, as we know, the diagnosis is sort of difficult, but still we cannot say that basically nothing is impossible. We are still trying. So definitive way is that we can do brain biospy and then exclude other causes of dementia. We have to exclude the other causes of dementia. And treatment is actually currently, we cannot say we have treatment, but we can limit it. We can try to, trying to limit it, but still there is, there is no actually medicines that can cure it completely, but still we are in midst of it. We are working on it. Yeah, people are working on it. Yeah, this is just a, so this is basically a more a video representation of amyloid beta, which causes the whole Alzheimer's disease. Yeah, and here you can see they make the whole cluster kind of, and then they stop the communication here. Yeah, also they just not only affect neurons, but they also affect microglia and other cells as well. Yeah, because they make problem between the neurons and things like that. The brain is not able to store the information or process the information very well, and that causes us trouble. Now again, this is the in neuron, inside the neuron, microtubules, and these are the we talked about these previously. Yeah, we talked about how they make it together, but then when the sulfate came, it leaves the microtubules and the microtubules shattered. Well, in this also, they are concluding that no cure occurs now. We don't know any cure of this disease, but let's be hopeful and hope that in future we'll be able to find. Now, these are the we can see it's a map where I have shown where it is shown that what kind of brain diseases we have in different region of the world. I should rather say that we are able to see more brain diseases in developed countries rather than developing countries. But maybe it's because we are not we have not diagnosed it, not because they don't exist, but because we haven't figured it out. We can see epilepsy here. We can see there's some cases in epilepsy in Europe, America, and different. They are basically the brain disorders sort of thing, like anxiety, ADHD, epilepsy, and then HIV. HIV is not the brain, but Parkinson's and all of this. So it's shown in the map. Yeah, that's pretty much about it. Thank you for listening. Thank you for listening.